If you're autistic or think you might be, you might have felt this. You're suddenly exhausted, anxious, unable to do things that once felt easy. You cancel plans, you forget to eat, you stop speaking, or feel like your body is shutting down. You wonder, what's wrong with me? This might be something we call autistic burnout. Hi, I'm Dr. Dona, youth and adult psychiatrist, here to discuss all things mental health and wellness related. And in this video, we're going to discuss what happens with autistic burnout, why it happens, how to tell it apart from depression or anxiety, and what you can do to start healing. Whether you're autistic yourself or love someone who is, this is for you. So what is autistic burnout? Autistic burnout is a state of intense physical, mental, and emotional exhaustion that stems from prolonged social, sensory, and cognitive strain. It's not just being tired after a long week. It's like your entire system, your mind, your body, your social battery just shuts down. You might feel less able to communicate, make decisions, perform daily tasks, and even tolerate basic sensory input. One of my patients told me, I used to have friends, work full time, and hold it all together. Now I cry when someone texts me, I can't handle noise, I don't recognize myself. That's burnout, not failure. So what can autistic burnout look like? It can look like loss of functional skills, regressive behaviors like mutism, shutdowns, increased sensitivity to light, sound, texture, heightened anxiety or panic, flattened mood, withdrawal, feeling depersonalized or dissociated. So why does this happen? Most autistic people experience some level of masking, consciously or unconsciously mimicking neurotypical behaviors to fit in. Masking includes suppressing stimming, forcing eye contact, scripting conversations, downplaying sensory discomfort, or faking confidence. This isn't just tiring, it's exhausting. Day after day, week after week, it adds up like emotional debt. Recent studies show masking is linked to increased rates of anxiety, suicidality, and burnout in autistic adults, especially in those who are diagnosed late. Add sensory overload, lack of accommodations, and life stress, and the body eventually goes into a shutdown mode. It's like running a computer with 40 tabs open and no charger. It just crashes. So this is what many people get wrong, even professionals, and that is what is burnout versus depression versus anxiety. So let's differentiate between autistic burnout, depression, and anxiety. Autistic burnout is defined as a state of physical, mental, and emotional exhaustion experienced by autistic people, typically after prolonged masking, sensory overload, or navigating inaccessible environments. Core features are extreme fatigue, mental and physical, not relieved by rest, regression in functional skills like speech, executive function, and self-care, heightened sensory sensitivity, loss of coping abilities or shutdown, increased social withdrawal, not necessarily due to sadness. And this can often be misdiagnosed as anxiety or depression. Key differentiators are they can be triggered by cumulative demands or prolonged masking. They might feel emotionally flat, but not necessarily sad, and is accompanied by a sensory overload or social aversion, and is improved by reducing demands, reconnecting with special interests, and unmasking. Now, here are some core features and components of anxiety, generalized or social. Anxiety is defined as a heightened state of worry, fear, or physiologic arousal about future or uncertain events. So our core features are excessive worry, often irrational, physical symptoms such as tension, restlessness, GI upset, and rapid heart rate, avoidance behaviors, hypervigilance, and it can be constant, such as in generalized anxiety disorder, or triggered by social situations, performances, etc. Key differentiators are emotional hyperarousal versus autistic burnout, flatness, or shutdown. Anxiety might drive rumination and a need for control, not just withdrawal. And anxiety will respond to CBT, SSRIs, and grounding techniques. And it's less likely to cause skill regression or motor shutdown. As for depression, this is a mood disorder that's characterized by persistent sadness, loss of interest, and disruptions in sleep, appetite, energy, and self-worth. Core features are persistent low mood or irritability, anhedonia, loss of pleasure, feelings of worthlessness or guilt, low energy, poor concentration, sleep and appetite changes, suicidal ideation in severe cases. Key differentiators are depression includes negative self-perception, I am worthless, and autistic burnout may have I'm overwhelmed, but not inherently self-loathing. It often persists regardless of external demands, whereas burnout is context-driven. It may not include sensory issues or skill regression, and it tends to flatten all affect, whereas burnout may preserve certain emotional connections like special interest or safe people. You can have all three, burnout, anxiety, and depression, but understanding burnout lets us treat it the right way. So how to know that you're in burnout? You can ask yourself, am I suddenly less able to do what I normally manage? Are sounds, textures, or lights even more unbearable than usual? Do I feel emotionally blank, even in situations where I usually feel something? Have I started avoiding communication, even with people I love? Do I feel invisible, like I'm going through the motions just to get by? If yes to most of these questions, you might be in burnout. You're not faking, you're not regressing, you're in survival mode. So what can actually help? Number one could be giving yourself radical permission to rest. You need rest like you need it after surgery or an injury. This is not laziness, it's neurological recovery. Cancel where you can, say no, postpone, communicate with your inner circle, or don't. Silence can be healing too. Number two, drop the mask if it's safe. Stimming, scripting, and self-regulation are not embarrassing, they're tools. Use them openly if you're in safe spaces. Number three, sensory regulation. Lower exposure to overstimulating environments. Use weighted blankets, blackout curtains, or noise-canceling headphones. Eat familiar comfort foods, even if they're repetitive. That's okay. Number four, focus on bare minimums. Think, have I eaten, hydrated, toileted, and slept? Set alarms for meds and meals. Don't worry about thriving, stabilizing is the goal. Number five, you can reconnect with joy in tiny doses. Reread a childhood book. Watch a calming show on repeat. Rock, swing, stim, let yourself be nourished by sensory joy. Number six, seek autistic affirming support. Look for therapists who understand neurodivergence. Support groups, even virtual, can help you feel less alone. You might not be able to unmask everywhere, but you deserve to have somewhere you can be your whole self and feel safe. Autistic burnout isn't a failure of strength, it's a cry from your nervous system that's been doing too much for too long. You are not lazy, you are not broken, you are not alone. If this video resonated with you, please let me know in the comments. I'd love to hear your story. And if you want more compassionate mental health content from a psychiatrist who truly cares, subscribe and I'll see you in the next video.